Times of COVID-19, we still soldier on and will still keep your leadership to task. In regards to the promises that they made right here on Pledge Watch, hashtag Pledge Watch is where you can, of course, interact with us. Tell us what you think about today's show. And most importantly, who's the next Mheshimiwa you'd want us to bring on board. But the main focus of the day, Runyenjes Central. And guess who we're having on board? Indeed, a very vocal leader, like I started by saying, a leader that has seen himself going back to the leadership of course, Runyenjes Central for the second time, something that was not very, expected, or maybe was not so common, especially with the aspect of devolution. And we're talking about Steve Simba. As you can see his profile running on your screens, trying to remind us of what he is. He's the member of County Assembly. He's equally the Deputy Speaker, Embu County, and the Chair Budget Committee. And indeed also, we'll take a look at some of, what he's done, or what it is that he's done for the people of Runyenjes Central. And, we asked that candid question, what could have informed him getting back into power? Remember very well that the very first time that we had our leadership and, devolution being sort of brought on board, the first time we saw very many MCAs, so many going back to sort of try and see whether they can defend their seats, but they were not able to defend their seats. So what is so special about Steve Simba, or what is it that he's done to the people of Runyenjes Central that got him going back to his seat and position? We do not forget to address the aspect of COVID-19, which is key. But before I delve deep into this, remember it's important that you interact with us. Hashtag Pledge Watch is where you can drop those SMSs or those messages or those tweets, and we get to sample some of them as we proceed with the broadcast. But most importantly, let's first of all take a look at what is happening in the world of news. And we kick off immediately as the Health Ministry has now announced 8 more positive cases of the coronavirus in the country, raising the total number from 208 to 216 within 24 hours. Speaking during the daily update of the country, Dr. Mercy Mwangagi, the Chief Administrative Secretary, the department, said 5 of the new patients were Kenyans and 3 foreign nationals. Take a look.
The virus is now domiciled across the length and breadth of our republic, from down south in Kilifi to Mandera in the north, from the west in Vihiga to Kitui in the east.
Of the 8 more cases of coronavirus in the country are said to have histories of travel to Zambia, the United Kingdom, the United Arab Emirates, Comoros and Pakistan. 6 of the new cases were reported in Nairobi, 1 in Siaya and another in Nakuru. This coming after the analysis of 649 samples.
In the last 24 hours, fellow Kenyans, we have tested 694 samples. Out of these samples, 8 have tested positive for coronavirus disease, bringing the total number of confirmed cases in the country to 216. 5 are Kenyans, and the other 3 are of different nationalities, foreign nationalities.
Dr. Mercy also stated that 1 more person has recovered and has since been discharged from hospital, raising the total number of recoveries to 41. The Ministry of Health is set to deploy 12,000 testing kits for the mass testing exercise in prioritized target areas including Kibra in Nairobi, Mandera and Siaya. Efforts towards mass testing in the country are underway and are set to begin in various parts of the country, with priority given to areas cited as more prevalent.
We must work even more closely with our county government to tighten our control measures, to harmonize our responses and mobilize our people to take an active role in this fight. In this regard, we are rolling out mass testing exercise, taking into consideration the risk profiles of clusters. And as an example, fellow Kenyans, in Nairobi, for instance, we shall prioritize the quarantine centers, hotels, isolation facilities, and hospitals.
Majority of those infected are said to be those in the youthful bracket, considered to contribute majorly to nation building.
Patients who fall within the age group of 0 to 14, we have 15 to 19 falling to 58% in terms of count, and we have about 64% of our cases falling between the age group of 30 to 59, again affecting the productive members of this society.
And to ramp up efforts towards fighting coronavirus in the country, the Principal Secretary has commissioned testing healthcare workers at the Kenyatta National Hospital to ensure they know their status before offering health services.
Hata mimi ni muuguzi namba 1, nimeweza kupimwa leo kwa hivi virusi vya corona, na ni muhimu sana kuhakikisha kwamba mara kwa mara tunajaribu kupima hawa wauguzi ambao ndio wako kwa frontline ya kutukinga na kututibu watu wakiwa na ugonjwa wa corona.
The exercise, to be replicated across all county facilities, is meant to ensure all healthcare workers are adequately protected during this period of fighting coronavirus in the country.
Program imeanza, wafanyakazi wote katika hospitali hii, wale ambao wako katika Mbagathi Hospital, wale ambao wako katika Kenyatta University Hospital na mahospitali zetu za county wameanza kupimwa.
Leangare for TV47.
Well, and away from that to some bit of politics. In a matter that has seen allies of Deputy President William Ruto protest, a matter where a list of names of officials intended to make up the National Management Committee of the Jubilee Party has elicited stern sentiments. So today, the Office of the Registrar of Political Parties confirmed that it indeed received the concerns of various party members. The Registrar of Political Parties says she received varied reactions from a cross-section of Jubilee Party elected leaders and party members. Paul Kirobi tells us tonight the response of the Registrar of Parties and the supremacy battles evident between the party members.
Raila Amolo. Following a gazettement of notice of a list of names submitted for the intention to change the National Management Committee officials of Jubilee Party, the gazetted notice sought for written objections from members of the public with 7 days from its date of publication on 6th April 2020. During the 7-day period, some members of Jubilee Party took to various platforms to echo their concerns. A case in point, Majority Leader Kipchumba Murkomen, claiming Leader of Majority in the National Assembly, Aden Duale, was not exercising independent judgment on the recent developments rocking the party. The gazetted list has sparked a war that even the Deputy President William Ruto has termed as being engineered by what he termed as conmen whose elegance is pointed elsewhere. The list of names submitted for the intention of forming the National Management Committee of the Jubilee Party that have been gazetted include Lucy Nyawera Macharia, Marete Marangu, Walter Nyambati, Jen Nampaso, and James Waweru. The section of leaders and party members objecting the gazetted list of names have since left protest letters at the office of the Registrar of Parties over the installment of new members. In its response today, in a letter dated 14th April 2020, the Office of the Registrar of Parties has stated it received varied feedback from a cross-section of the Jubilee Party, elected leaders and party members. The office has today further stated that it will collect and analyze the submissions received as soon as it is practically possible and deal with the submissions as per laid down procedure and the law. After today, what remains to be seen is how this new twist in the Jubilee Party will turn out as the days go by. The push and the pull ahead of the 2022 election battle is becoming more evident. What remains to be seen for now in the coming days is the fate of the gazetted list of names, which a section of the Jubilee Party members still feel were not sanctioned by the relevant party organs through a formal meeting. Reporting for TV47 News, I'm Paul Kirobi.
Kirobi, for that, we'll certainly be here to keep you up to tabs, of course, in regards to what is happening in the world of politics. Interesting times ahead, not just for the country at large, but of course also for the Jubilee Party. But that aside, I think it's important also we take a look at what has been happening right here in the country, and the National Assembly has resumed its sittings. But before we delve into that, I think it's important that we engage Mheshimiwa, who's on standby. Good evening, Mheshimiwa.
Good evening.
I'm fine, thank you. Thank you so much for finding time to be with us.
Thank you very much.
All right, so it is good to have you this evening. The people of Runyenjes Central eagerly waiting to hear from you. We have lots and lots of questions amid all this talk of matters COVID-19. One would argue that maybe that is the only thing that we should be focusing on, but there's still so much, and you know the country has to run all the same.
Sure. But basically we cannot really overlook other issues
I
and
agree.
don't think about COVID. In fact, my worry really is that we might concentrate so much on COVID and forget other patients healing from other conditions. So basically, we need to strike also a balance. Even as we think of COVID-19, let us also remember the other patients that also need the attention of our medics.
All right, thank you so much. And but I mean, one thing would be the first question that we'd want to ask, or everyone would eagerly sort of want to know, as we talk of matters COVID-19 right here. I mean, across the country, every other county preparing itself, in regards to how they're able to deal with this. For a moment, we've not really heard much from the governor of Embu, that is Martin Wambora. I mean, what would you tell us? The preparations on ground in Embu County in regards to dealing with COVID-19?
Very well, that has been really a concern from most of the people of Embu, that the governor is a bit silent, is not really talking. But I think we have been engaging him, that you also need to come up with the ways and means of how we can also be part and parcel, or we may be also featured as a county that is also thinking about their people. But basically today we had a special sitting,
right,
so that we approve a supplementary budget, and the governor brought a proposal of about 29 million to combat the COVID-19. But also as MCAs, we felt that we needed to give much more. And out of the ward fund kitty, the ward fund kitty is about 20 million per every ward.
Right.
We felt we can give each MCA 5 million. So we were able to give 100 million to the county, so that we can have more medics being brought on board, especially the community health workers. We also thought that there are those nurses and that are really not well paid and the clinical officers.
Some of them went on strike, were actually complaining about this just the other day.
Yes, about the PPEs, and that's why we are telling also, we also say that let's not have excuses about availability of funds, because the Public Finance Management Act is very clear that the CEC finance, which is actually the hand of the county treasury, can spend any amount on emergency and report to the county assembly within 60 days. So we are telling the CC Finance, kindly, COVID is a priority to the people of Embu. Because even if you make roads, even if you do schools, when our people are dying and all, when our people are exposed, it makes no sense. So that we really prioritize on this COVID-19. And I can tell you, we are not doing very well. We might be on the right track, but we are not doing very well as a county, but I am hoping that with time we will be able to pull up ourselves.
That's a little bit questionable, and I'm sure anyone who's watching you from Embu would be worried coming from sort of the leadership. But before we even get to understand why you think we're not doing very well or Embu is not doing well, then the question would be, what is the role of the MCA or the role of the MCAs in unison towards helping the governor or the county government on this?
Okay, basically for us, one is the political goodwill, because we appropriated the funds, and the MCs are not the implementers. Basically, is if they want some funds, we make them available through a registration, and that is why today we were in assembly. The whole day we were in assembly to make sure that funds are available, to make sure that whatever they need we provide. So there's political goodwill, and I think the MCs agreeing to give out, to forego some of the project in their own to a tune of 100 million, it shows very clearly there's that political goodwill. Secondly, it's about the oversight. The MC's role is to make sure that funds appropriated for a certain purpose are well utilized. So if it's about the PPEs, of course, the CCs and the chief officers are accountable to the people through the county assembly. So the last week, and I know I saw a clip that you played, that we had summoned the CC Finance, the CC Health, Pwana Patrick Waganagwa, and also the Chief Officer Grace, so that they can be able to tell us, so that the people of Embu can know whether they have a work plan, they have a budget, or what is their plan, how prepared are they. So they are accountable to the people through us as assembly. And we have been providing those platforms. We summon them, we are hard on them, because our people must see something being done. Reader.
All right. So in summary, what would be the plans that you guys have set, or the members of the county assembly have set alongside the leadership of the county towards ensuring that the monies that will be dispersed, especially right now that we know very well that there's been a sitting also on this side of Nairobi from the members of parliament, and the main discussion was revolving around the supplementary budget that is supposed to be taken to the level of the county. So what are the key plans in terms of some, as you summarize, that you would be having, so at least the people of Embu have a clear picture of what to expect?
So basically we've agreed that we lock our county from our borders. As you get to our county, you must you must check your temperatures so that we are sure the people that are coming in Embu they are okay. Secondly, we have the ambulances on standby so that if your temperatures appears to be a bit, you have fever or something, you're taken care of. Then we have also agreed that we make available the PPEs for our medics, and also we are fast tracking the employment of nurses and the community health workers together with the clinical officers and other medics that we believe will really assist us in this. Also, we've also agreed as a committee of health, we'll be moving around to check the level of preparedness and check how the isolations are done. How the schools for the quarantine, how they have been prepared. Right. So they can be sure we are doing something. And just all I'm asking the government is that let us move with the speed. Let's pull up our socks. Right. Let's be more vigilant. We have seen, I've taken an initiative myself, and I said half of my salary for the March and April. I'll also give it. Yes, I'll channel it to that, and I've already started. I started by fumigating markets in
yes, that we'll discuss as we proceed. Yeah, that is commendable, and we'll discuss as we proceed. But briefly, yes, I agree. At some point in time, also you as MCAs have given out 22 million to the county government, sort of to top up to this particular kitty. So as we are talking about COVID-19 in terms of facilities, in terms of, that is the medical facilities, probably as we cross over to a different, topic. I mean, what would you tell the people of Embu, in regards to the preparedness and making sure that these facilities are in the best of shape? I mean, can they be confident enough that in the event that this strikes, they'd be able to handle it?
We have visited some, especially the level 4s, because the national government, together with the counties, we agreed that the level 5s and level 4s, there will be an isolation, ward for the COVID-19 victims. And we visited some, around 4 of them, and I can assure the people of Embu they are well done, they are well isolated, and we are sure that the PPE materials have been, the trainings have been done. So I believe we are prepared. We might not be there, but we've done, let's say, around 70 or 80%. But we are hoping to get to about 90%.
All right.
Because yes.
Well, it's a foreign thing. Not everyone across the world is not sure of what exactly or how exactly to deal with this. But then again, also, it's a bit of worry when you mention that, yes, the people of Embu should be worried because not so much has been done, and maybe you're not yet there just yet. But I would say an 80% is fair enough. So, Mheshimiwa, before we come back to you again, I think it's important that we cross over to this last story that we'll be picking this evening. Also a story that will form the basis of our conversation. And the National Assembly has resumed its sittings today. And of course, their major target being the supplementary budget to cushion Kenyans on COVID-19 pandemic, which has hit the country. Let's take a look at what Liz Mutuku has prepared.
After a month-long recess, the Parliament resumed its sittings, observing the required measures as set by the Ministry of Health concerning the COVID-19 pandemic. The House was not short of drama as the Minority Whip Junet Mohammed in the afternoon session asking the Speaker to allow members aged 58 and above to work from home, a matter which raised a heated debate in the House.
For the safety and security of this House and members of this House. Mr. Speaker, one of your guidelines was anybody above 58 years should not appear in the chambers. And I'm seeing Honorable Kimunya, I am seeing here Honorable Bokose. These are octogenarians who should be at home, Mr. Speaker. We don't want to lose any member of parliament, Mr. Speaker. Mr. Speaker, we love. Another one is the MP from Meru, Honorable Kubai. Kubai retired from civil servants before we were born. And he's here, Mr. Speaker. Mr. Speaker, we love each other, Mr. Speaker. And I am doing it out of good faith and good heart, Mr. Speaker. I want us to be here after Corona, Mr. Speaker. So when you are told you are above 58 or 60, stay with your grandchildren.
National Assembly Majority Leader Eden Duale took the issue with the claims of the parliament being dysfunctional.
You know, somebody somewhere said parliament is dead. So I asked him, you can only say your house is dead. And I asked him to watch this afternoon, and I hope he's watching from wherever he is. Because based on what we have today, it tells you that all that the president said can only be implemented by this House.
On the issue of 2% tax reduction on goods as directed by President Uhuru Kenyatta to cushion Kenyans over the pandemic, now members want it reviewed and money is redirected to the basic needs such as food and water.
If that money was targeted to that Kibera person as compared to when it is targeted to Bandi. And this is what we are saying, Honorable Speaker. The economists in Treasury must do their work. The issue here, Mr. Speaker, is targeting. We would rather get this money for 9.5 billion and provide basic requirements to people in Kibera, people in Kwanjenga Mkuru, people in Madare, and people who are in a rural setting, Mr. Speaker, who we have already said they are vulnerable groups. In that case, we'll be helping Kenyans.
But I know the president means well, but I want to oppose as a leader, and I believe this is the reason as to why this matter is remitted to us, that we help the president and the executive as the leadership of the nation in this assembly think through how to pull our people in this pandemic. I therefore oppose.
However, members are now calling upon all the business owners not to exploit Kenyans during this pandemic era and more so accountability on the money directed to the COVID-19 pandemic kitty.
The businessmen and women of this country are very quick at increasing prices. But whenever we have come up with a legislation that is supposed to go into helping to alleviate, reduce the burden on individual Kenyans, the business people are very reluctant. They want to enjoy the very support that you are giving to individual poor Kenyans by making huge profits. This is not the time for business people to make profit.
As the National Assembly is slated to be convening once a week, now all eyes are set on the actions of the August House to speed up supplementary budget process, which will ease the economic impact the pandemic is having on Kenyans. Elizabeth Mutuku, TV47 Nairobi.
All right, yes, and from that particular story, we cross over to you, Mheshimiwa, and I'd want you to react to the same. The National Assembly convening today, this was long overdue. A majority of Kenyans kept on saying that it was necessary that they go and address this issue. And today they talk about the supplementary budget. And, you know, it had its fair share of drama, the likes of Kipchumba Murkomen arguing that the National Assembly is dead. But then again, we would love to hear your take in regards to this and how, you know, important or instrumental it will be towards helping the nation deal with COVID-19.
Very well. I also watched and I realized that they were also creating an emergency fund, kind of emergency fund, because a fund must be created by either an act of parliament or the county assembly.
Yeah.
And you heard the Speaker of the National Assembly saying that if the assembly will not agree with the emergency fund, of course, even including the committee, then it
Think we lost Mheshimiwa right there, but not to worry. We'll take a short breather and we'll come back with him. I'm sure things will be fine by the time we're coming back from this particular break. It's also important that you interact with us. #PledgeWatch. And the number running down your screen, 0768095491 is the number to call in the event that you have any questions for Mheshimiwa, aside from what what his sort of county or his ward is doing towards addressing the aspect of COVID-19. It's also important we take a look at some of the key things that he's done towards ensuring the development is felt in Runyenjes Central. So we take this breather and we'll be right back. Don't you go anywhere.
Since late last year, the coronavirus COVID-19 has emerged as a serious healthcare threat. This is an infection that has gone global and no one has been spared. The government, through the Ministry of Health, has put in measures to keep Kenyans safe against COVID-19, which is currently rampant around the world, with new confirmed infections and death cases daily. Such sanitization and screening of visitors at this border post and across every entry point in the country is very vital in preventing the spread of the disease in the country.
I'm very happy about the screenings that are going on in Tanzania and Kenya. I think it's very proactive that you're thinking about stopping it at the border so that it does not spread.
It is scary that a single cough here can lead to an outbreak of epic proportions. In order to prevent that, the government has instituted measures to keep Kenyans safe.
The facility has all the equipments you need, from handling a basic patient up to ICU setting.
However, you also have a role to play in preventing spread of infections.
Citizen responsibility is the key to the success of this initiative and these measures. Let's all do what we have to do individually. And this is how we are going to defeat this disease.
It's just our general hygiene, okay? And that now means at workplaces, we should ensure that our work surfaces are clean.
Always ensure that nimefanya proper sanitation ya mikono. Every time na board matatu, lazima ni sanitize mikono.
We have faced many severe challenges as a nation, and we have always found a way to rise above them. COVID-19 is no different, and we will overcome the pandemic. Stop coronavirus. Follow all directives from the Ministry of Health. Wash your hands properly.
For more inquiries, please email ads@tv47.co.ke or simply call us on 0748 205 604.
Welcome back to the broadcast. Thank you so much for keeping us company. So much feedback coming in. Of course, we'll be going through some of your comments as we proceed with the show. But we cross over to Mheshimiwa once again. And Mheshimiwa, Pledge Watch is squarely about the pledges, just as the name suggests. And now I'll cross over to you. And now particularly as we get to focus focus on your ward, that is Runyenjes Central. And as we talk about COVID-19, I think it's key now that we take a look at the health facilities across the county, but most importantly on Runyenjes Level 4 Hospital. What is its state as it stands today?
Very well, we've tried our level best. I think since I became the chairman badge, this is my second year.
Yes.
We said that the only way to decongest the level 5 is by making sure that we fix the level 4s. And we have been having a lot of challenges in our level 4s because a lot of emphasis was on level 5.
Right.
And what we've done is that, one, we gave around 27 million to equip the level 4s. And secondly, we've been able to allocate at least 8 million in every level 4. As today in Runyenjes, the other day, around 1 week ago, I did visit, and I can tell you and I can tell my people there are enough drugs. There are enough drugs.
There was a question on the aspect of cleanliness, and some people sort of felt like it wasn't up to standards.
Well, the cleanness is there, but I know the tiles looks a bit old.
Yeah.
But I can tell them part of the 8 million is to retile again the entire facelift of that hospital. So basically, they will be seeing something new happening. It's only that we had quite old buildings that appear made the hospital appear like it's not really very clean. But I can tell them with 8 million, we're expecting the contractor to be on the site either this week, before the end of this week, and those are the areas we'll be touching. Facelifting, you do the retailing, you do the tiles, good ones. So basically the hospital will be better. But you see what is important is about the services.
Right.
Because you can have a very, the hospital might look very good, but there are no services. What we've done in level 4, in Runyenjes level 4, is that now we have 175 staffs, and with around 2 doctors, and we have around 5 clinic officers, 30 nurses. I can tell you we have around 4 pharmacists. We've been able at least to do something, and we're in the process. And I can assure them Runyenjes level 4 hospital is not like how it was before. We are doing a lot. And one thing that I can assure them is that there are enough drugs. So our people should not feel like before there was a challenge of drugs, but I can confirm to them there are drugs because I was there the last week.
All right, they would be worried that we are talking about modernizing this, but what about the dispensary in Biruri, that has not been accomplished till date? What would you say about that briefly as we cross over to another issue? Biruri. Dispensary.
Sorry?
Biruri dispensary.
Biruri dispensary.
Yes, it is not accomplished to date, that's what they say.
Yes, those are part of my campaign pledges.
Yes.
Of course, one of the object of devolution is to take services closer to the people.
Yeah.
And I did promise them that I'll be doing a dispensary. Now, this budget, we already have 5 million. What is really making it a bit difficult is the process of acquisition of land. Because what happens is, when you approach a certain, these people to the citizens to sell land to government, they have exaggerated the figures, and sometimes the government follower feels that this price is too much, so he declines to give a positive report. So that is the biggest challenge, and I've been pleading with the members of public, especially from that area. They show me a land that we can buy, but of course, sell to the government at least on a price, so that we are able to procure that land and put it and have the hospital and the dispensary. I can assure them, once we get the land, even if we get that today at night, tomorrow the contractor will be on the site, and within less than 6 months we'll have the dispensary.
And that is their biggest fear, of course, couples up with that aspect of, you are on the last term, almost winding up with this. But before I ask that, which will come to us the last bit of it, I think it's important then we address this aspect of your interest also, that was part and parcel of your campaign promises, that you are going to empower the youth out there. And we've seen the coming up of, different, projects in regards to ensuring that the youth are empowered. For instance, projects that would help them, raise or take their talents to the next level. How much are they taking advantage of this, or to what level is it instrumental towards, making change for the youth in terms of, creating employment and so much so?
Very well. Of course, when it comes to the youth, I usually tell the young people that when you're dealing with young people, you must categorize them, because there are several youth are put in several categories. There are those youth that are in college. Their greatest need at that point in time is the bursaries. They want to be assisted to complete their education. Now, there are those young people that are already through with their college. Their greatest need at that particular time is actually to get a job. So, and we have also the young people who are in business. Their greatest need is to make sure that they are given, that environment and they access funds for business. So when you're dealing with young people, there are those that are talented in sports, there are those that are talented in art. So when you're dealing with young people as a leader and as a politician, you must be very careful, so that you also don't think it's only the sports or arts that the youth are interested in.
Speaking of sports, Mheshimiwa, allow me to come in. Speaking of sports, as it stands, the Runyenjes Stadium, there have been complaints, and I think this is coming from the viewer, that, some of this bit has been turned into a dumping site, or the state is not in the best of shape. What would you say about that, even as you tell us how best we can tap in to the, the talents that we have within Runyenjes Central?
Yeah, very well. What I've done personally is that I've started with uplifting or upgrading the local playing ground, not even stadium, the playground. Because if you really want to tap talent to the young people, you must start from the grassroots. Like this year, I've been able to do Gatinda. Gatinda is a small village in a sub-location, and I've done, I've upgraded that playground. I've done in Gikore, Getare, also Kiga. So what we are doing, first we want to tap from the grassroots, so that even as you develop talent, you are able to get that young man from Mashinani who can be forgotten. Secondly, we have a program as a county. We've said we started with Embu, now we'll be upgrading the 4 sub-county stadiums. So we'll have Runyenjes Stadium, we'll have Omao, we'll have Siakago, and we have Nemburi. So the 4, because we have 4 sub-counties. So we agreed every sub-county will get a stadium. So I know the next will be Runyenjes, and we started by having a dais, but we want to have a standard stadium. You realize also, leader, it's very expensive to come up with the FIFA standards of a stadium. You don't come up with just anything and call it a stadium. So it requires a lot of funds, and we said we'll start with 20 million, but we've not been able to do it this financial year. But we agreed next financial year we'll have Runyenjes as the stadium.
Oh yeah, you mentioned the bursaries, and there's been a complaint from one of the oldies who argued that the last disbursements were actually given to certain students, but coming to the next one, these very students were not able to get the bursaries. What could have informed that, and what is the criteria of awarding bursaries?
Well, I think what the few is saying is that our bursaries got it.
Yeah.
But finally we give them out. Right. And the criteria is that we ask for applications, and I usually do a lot of letters, of course, in churches and in other areas, also using our local FM, so that the people can know that at this time, this point in time, now we are applying for bursaries. Right. And personally, I usually go another step by making sure that the forms are available to my people. I usually, photocopy many forms so that old mama, that shosho that cannot, get to the cyber and the logistics of getting a form, they're able to get a form. And so their role is just to apply and bring to our offices. Then we do the vetting. We do the vetting because we know there are people that their needs, they may need more than the other, because you'll find a total orphan. So you have to vet to know this kind of a person requires this much, so that you can give more to those that deserve more. So basically that's what you do. But the viewer is so much concerned about the delays. And I can tell you that the counties are struggling. Yeah. We are struggling because especially this financial year, we have been having difficulties in the release of finances. Even now, some of the MCs have not been paid since October last year. So the head of Treasury in Nairobi, the national government, we got to a point and felt like the national government want to kill counties. And until they come out clearly, they tell us they're still interested in devolution, we still feel that they want to kill devolution. Because if you don't, release funds, even like the March, because the finances are released on a monthly basis, like what we requested for March has not been released. It means that salaries have not been paid. So that is why we are struggling. You make requisition for drugs, Linda. It takes even a month or so to have the funds for drugs released. So the counties, the governors are struggling, with hospitals with no drugs, because the treasury is not ready to release funds.
Well, that's a conversation, Mheshimiwa, indeed, that has been ongoing for the longest of time. And hence the reason why we have this show, Pledge Watch, because then it will help us understand devolution more and what needs to be done to ensure that it is indeed a success. Now, let's take a look at some of your feedback. And Felix Fundi says, why did they decide to spray a fellow human being? That's an interesting, aspect that we'll look into. Clement Leisha says, one true leader whose mind, heart, and energy is with the people. And Jim Njagi says, Simba amefanya, I think he wanted to say amefanya, your kazi, but from Gadhuriri to Biruri, we have to use the longest route because ya ile njia ilifungwa Gadhuriri. And I think that will bring us to that aspect where we'll want to understand, how the state of the roads, and most importantly, the aspect of fumigating the markets that is within Runyenjes Central. The last messages at now, tell my Mheshimiwa he's doing great to protect our people from COVID-19. Remember, it's important that we interact with us. Hashtag Pledge Watch. Let's get to hear what you have to say. Keep sending those messages, and Mheshimiwa will be here to answer them. So let's talk about, first of all, the state of the roads. And now as we cross over to, the preparations that you're doing down there in terms of fumigating the market and how well it is done up to standard, so at least we also do not have issues that will come along, health issues that will come along with that. Mheshimiwa.
Okay, very well. Let me start by thanking the viewers and also those that are responding, and also the positive criticisms and even the negative. These are the things that make us.
Right.
Basically, the state of the road. So one of the reasons why I was voted back, I can confidently say that we were careful. on our roads, because some of us, the MCs, we connect with those people at the grassroots. And we made sure that we had opened several roads.
Right.
And also in my ward, there was a lot of, we did some tarmacking of the Runyenjes town. In fact, by the time I was given that ward, our town, Runyenjes, was a village town. Today,
someone is complaining, by the way, that the growth of of Runyenjes town is stagnated. He's asking why, and also says that there are constant water problems in the market. Yeah.
Unless I don't sure whether that person lives in Runyenjes, could be he doesn't have the picture of how Runyenjes was, because the time I was elected, there was the streets were muddy. There were no tarmac. I tarmacked the entire Runyenjes town.
Okay.
The entire town and couples. So we were able to get mud out of town. Secondly, there was no single right, not even a single, even in Mulikamuizi, there was nothing. But we made sure that there was street light running from up there to down, that the town has been lit at least. So basically, we had a bus park which was like a hell, so muddy, water everywhere. But today the capital work that has been done to that bus park,
allow me to ask
this. So the town has really grown.
Allow me to ask this, Mheshimiwa. What you're referring to was done during your first term or the second term?
Of course, the first term.
The first term. Now, let me ask this question again in regards to what another viewer has sort of asked. This is what they say. Mheshimiwa did well in his first term. Now, coming to the second term, he's so much so focused on getting the member of parliament seat, or I do not know whether it's a gubernatorial seat, that he has overlooked what he's supposed to do right now as a duty. Mheshimiwa.
Very well, that is not the case. Of course, we have been having a lot of challenge in terms of finances, and that's why I've said the finances, the release of finances are being a problem.
How is this well explained to the common mwananchi who's pegging or the argument on the promises that you made to them?
Yeah, but they have
lost. Right? Are you able to hear me? On that very note, are you there? Oh, yes, we're back. Mheshimiwa, yes? Yes, Mheshimiwa? Can you hear me? We missed you again. Yes, all right. I think you're back. So, yes?
Now, Mwananchi should also, Wajiko should remember where we have come from.
Right.
For the first time in history, Wanjiko should remember that he has seen governors walk on the streets of Nairobi demonstrating. You see, the governor, you were led by Oparanya. I was there. Yeah. The Oparanya leading the governors, leading MC.
Which sounded like, double speak, because then eventually they decided to take a chill pill. So what could have informed that? That is exactly what Mwananchi wanted to know. Why that about turn, if really we have the interest of devolution's growth?
So we also want Wanjiko to be true to herself, and also because and that is why there is a lot of technology, so that all of us we can know what is happening, so that they can know when Simba is cheating them or when he is not. They saw the governors, demonstrate against the National Assembly. Why? Because there were no funds. They had, actually we got a reduction of 154 million this financial year.
If this is the direction that it takes, then are we telling Wanjiko to be worried that probably devolution will not be successful for them to be able to get these services to the grassroots?
Wanjiko should be very worried. For the first time, we had a delay of bursaries.
Are you saying devolution was a mistake?
No. Devolution is good, but it appears that it's like there are people somewhere that want to keep devolution.
Right.
Because look at it this way. Now, the Senate, there is growth in the population. You are proposing lesser money to the counties, yet the population has grown. So you expect more people that they will need to access water, they will need to access, the medical services. So and you still revise the budget downwards. What does that tell you? We are killing devolution.
But aren't you worried, Mheshimiwa, that this is coming from the leadership? These complaints are coming from the leadership. Yet you are the very people that we elected so that you'd go and fight to ensure that devolution is a success. Are you telling Wanjiku to be worried on the kind of leadership that they elected? Or that's
yes. Now they should ask themselves, who is this leader that is not doing their work?
Okay.
And the problem of this country is the National Assembly, and that is why they even took a lot of time to go and approve an emergency. They all muted. And actually, I saw a newspaper today saying that they are traitors. So the National Assembly must shape up so that when they give funds to the counties, they don't let them know the mind that we are giving to the governors or to the MCs. They should know that service is required by Wanjiku, the same people who elected them.
Lots of corrupt cases and lack of accountability reported at the level of the counties. Embu is not an exception. And we have the members of the county assembly are the people who are supposed to oversight and ensure that this is done in order. We've not had the best of experience in Embu to a point whereby there was that push towards, seeing to it whether they can be able to impeach Governor Martin Wambora. First of all, one would want to ask, are things back to equilibrium in terms of how the county government is working with the members of the county assembly? And, should the people of Embu be comfortable to say that indeed now all these issues were sorted out and together you work towards ensuring that there is development in Embu?
Now, let me tell you, because leader, we also need to be truthful to ourselves and also very sincere to ourselves.
Okay.
Now, I realize that the people supporting the impeachment of Governor Wambora in our first term, they were not re-elected to some extent.
Right.
And so that tells you that when you fight so much for Wanjiku thinks you are fighting for yourself. When at the height of impeachment, I remember the people, were demonstrating, and a very good example is Kirinyaga. You've seen the push and the pull. That there are those people somewhere that they want to continually fool Wanjiku, and Wanjiku innocently gets to the trap that you are told these MCs are fighting your governor, but you are not asking yourself why is he being fought. What is the complaint of the MCAs? Yes, he paid himself an allowance of worth 8 million. Was he or she worth that? So that is so that the people also can realize that we are the watchdog. When the watchdog barks and sometimes bites, let's also Wanjiku know that they are the people who gave the MCAs that power. You gave us power even to impeach a governor, but the governor cannot impeach an MCA.
All right.
As an MCA can, so those are some of the things that also Wanjiku need to realize when it comes to the oversight. Because oversight is not a very good thing. When you are being asked to account for the funds that you're given, it's not a very easy thing.
All right, interesting right there, because in the best interest of time, let us answer this, Wanjiku, in the name of Felix Fundi, who said, or who asked, why did they decide to spray a fellow human being? This in regards to the fumigation process, within the market. And one would want to ask, is this in the best of standards? And why did you guys decide to fumigate all this on this one man in the market?
Very well. When we pushed that we need to fumigate our markets and this was not forthcoming, I felt that let's not take a lot of time, for push and pull. Please do this. I said from my own sources and from my own savings.
That is Simba Rescue Team, and the Simba Rescue Team, which many people are also asking, is it sheer PR? Is it also following, are you trying to follow in the footsteps of the likes of Mike Sonko? And aren't you worried of failing or probably sort of facing the same predicament that they did?
Well, yes, it's through Simba Rescue Team, and I'm following, in fact, I'm borrowing from Sonko, because personally I'm always touched by what Sonko does, because I think that is the kind of leadership that personally I may want. A leadership that identifies himself with the poor and the needy in our society. So basically, we agreed we fumigate Runyenjes markets and also the Mitumba shades. Also, we went to Kawanjara and also to Kianjokoma.
Right.
And the incidents, of course, it's unfortunate, and personally, I did apologize, is that that guy was really very drunk, and most people know him, and he really caused a lot of drama that he must be fumigated to feel that you'll be okay with the COVID. And so what I thought, so what those my guys did is that because we were already done with the fumigation. So he was just sprayed with a few water just to fool him that you've been fumigated, so as to avoid the drama at night.
All right, but so the process is ongoing.
So basically, it was not fumigated.
Right.
Yeah.
The process is ongoing. Yeah.
Yeah, we are still targeting other markets.
All right.
Where the county will not manage, we will still do that.
All right. Thank you so much, Mheshimiwa. In 30 seconds.
Yes.
The biggest worry of the people of Runyenjes Central is this is your last term. And you have complained about funding, and you've complained of how impossible it's been for you to be able to achieve some of the promises that you made. What would be your words to them this evening as we wind up?
Well, there must be challenges, but that is why we are leaders. We will square that and they should not get worried. We will achieve all our pledges, so they should not get worried at all. That's why we are leaders.
Yes, his very own words that the people of Runyenjes Central should not be worried, because yes, he will be able to achieve all his pledges. Will put him to that, or will be there, of course, to ensure that he gets these. And even in the event that he does not do that, we'll still invite him to explain to us why he was not able to achieve all these promises. Thank you so much, Mheshimiwa. It was great having you. And I must say thank you so much to you also back at home for keeping us company right from the word go, your feedback. It was great hearing from you this evening. We had Simba Steve, who's the member of County Assembly, Runyenjes Central, and equally the Deputy Speaker, Embu County. It was great having you. I mean, I won't be able to go through all these messages, but I am, of course, grateful that indeed you were able to send in. We'll be sending some of these questions, of course, to Mheshimiwa, and then in his own special way, he will be able to address that. It was great having you. My name is Linda Alela. Again, of course, we'll do this on Tuesday. As always, who's the next leader? That is something that we'll be getting you to know in about a week or so. Thank you so much. To the great, of course, the team that has done this and, made this broadcast a success, Asante Sana. And, of course, I was doing this with Anne Wairimu, who's my sign language interpreter. Do you have yourself a lovely, lovely evening and enjoy the rest of your viewing.